So all the antidepressants have similar effectiveness, about 30 to 40% response, and actually it's a little bit lower than we used to think. We just have results from a major study called STAR-D, which is a big national study on antidepressant effectiveness, and they sort of said it was about 30 to 40% for first try. You usually get a response in about 6 to 8 weeks. Meaning that, if you titrate up these medications, meaning I think for something like fluoxetine, probably like 20 milligrams or 40 milligrams would be a good dose. In 6 to 8 weeks, you should see some response. There's reasonable amounts of discontinuation rates, and I actually don't remember what those were because in the STAR-D, but there are side effects, so people do have side effects and the medication will stop it. I think common side effects include the nausea, feeling kind of out of it, foggy. A lot of people feel foggy, tired. Sexual side effects bother a lot of people. I think about half of people have that. There are several ways to work with those side effects, and actually we'll go over them later.
What is the best time to have them take the medication, morning or night?
It really depends. There's no right answer for that. It depends on the medication, and it depends on an individual's own response. So even with the different SSRIs, it can be a little bit different for different individuals. It's hard to give a blanket statement.
We have pharmacists at Princeton, and they actually recommend that patients take them in the morning.
It's like I said, I think that if you see people and actually ask them about their side, at least I know what pharmacists say, but I don't think there's any rule for this. I think that in general, you just want to make sure that you listen to them, and I always say, you give it a shot. Take it in the morning, see how it works for you. Next week, take it in the afternoon, see how it works for you. Take it in the evening, see how it works for you, and then write it down and we'll figure it out.
The other thing I would also add is that as long as the patient remembers to take the medication, that's the most important thing. So I think that's the main reason why pharmacists tend to suggest taking it in the morning. Now, certainly there are some that, there are some that are more activating. There are some that are going to make people a little bit more sleepy. So, there are going to be differences for them. But most important thing is that they take the medicine.
That's right. Yeah, he makes a great point because half people who say they're taking them aren't taking them.
We actually, they come in with their bottles and we actually count them.
Yeah, well, they can if they want to be good patients, they can do. I had a Korean American patient, a woman who was 72, that I treated for 3 years at Asian Pacific Counseling Center, and she would come every month religiously to my appointment. She said she was taking her medications, and about 2.5 years into treatment, her children came one day with her, and they literally brought 3 boxes of medication. She never took a single thing, and then actually at the appointment, what the children said, I said, well, it's really confusing because she's been coming to see me for 3 years now, every month. She never misses a point. She'd bring me socks on Christmas and cologne, right? And it turned out that she really wanted. Her children never came to visit her, and I reminded her of her children. Isn't that interesting? So you can never actually. There's lots of different motivations for people to come. So that was the most striking story that I.
So in a sense, that was more effective than.
Well, it was effective for the day. Yeah, it was a social networking part. Anyway. So. I don't know, how much detail do you guys want on these?
A lot.
You want a lot? Okay. I'm just curious, just because I want to see what kind of comfort level.
I want to know whether culturally, whether it has a different effect for different cultures.
Well, okay, there's two. Okay, so any other? So one question was, is there any differences between cultures or races? Any other big questions?
Yes. If they scored 20 on PHQ-9, would you start them on a higher dose?
No. So the question was, is if they had a higher score on the PHQ-9, would you start them on a higher dose? No. Okay, any other questions? Okay, and you guys want to go into excruciating detail? Yes. Okay. So these are the medications. They're actually, fluoxetine, Prozac, and the top name is the generic. The bottom name is the brand name, right? They're actually, in terms of effectiveness, they all work roughly about the same. Right? So, you'll hear doctors or you'll hear drug reps come through. They'll say one thing's better than another. The reality is they're all pretty much the same. There are some slight differences in side effects. So, for example, something like Paxil, they say is more sedating. It's probably true. But roughly, even the side effect profiles are very similar to each other for these particular medications. Let's see. The common side effects, as everybody knows, is greater than 10% insomnia, restlessness. So people feel a little bit edgy, agitation. Sometimes people get a tremor. Sometimes people get nausea and diarrhea, which is kind of strange. Headaches, dizziness, sexual dysfunction. The one thing about the side effects is that they go away. If people over 3 to 6 months, if people get better with their depression and they're able to tolerate the side effects generally go away if people are patient. And I think just reassuring people that they tend to go away, except for maybe the sexual side effect, that doesn't go away.
You aware of any effects on people who have difficulty getting off the medication?
You mean the antidepressants?
Yes.
Well, and when you say, the question was, are there any effects of people who have difficulty? When you say difficulty getting off the medication, what do you mean by that?
Having strong side effects.
Oh, from withdrawals. Yes. So in general, with these medications, there's not a huge withdrawal effect with these particular medications because of what we call the half-life. There are other classes of medications that there are. But in general, there's differences in how people respond. So you do want to, quote unquote, titrate people off slowly, meaning you want to get them off over maybe a couple weeks or a month.
Because I've seen more difficulties with our clients who've been on Prozac, being able to.
You want to wean them off. Yeah. So Prozac, fluoxetine, you get 10 and 20 milligrams. The therapeutic dose is between 6, 10, and 60. Usual starting dose is 20 milligrams. Usual dose is 20 milligrams. You can start on 10 milligrams. It's got a long half-life, so it generally tapers itself, but some people do have withdrawal effects. It's available as a generic, so that's nice. So it's cheap. So it's $4 a month, as I like to tell people. Paroxetine or Paxil comes in more dosage forms, 10, 20, 30, 40. You can go 10 to 50 milligrams. Actually, I think that's incorrect, but you got 20 to 30 milligram usual dose. Starting dose is 10 milligrams. It has what they call histaminergic side effects, so kind of like with Elavil, dry mouth, constipation, weight gain. Generally don't want to use it with older people. But it is also available as a generic, so that's nice. Escitalopram, this actually is not available as a generic. It's a cousin of Celexa. I like to call it Coke and Pepsi. Or Coke and Diet Coke and Coke Zero, in that they're more similar than different, and unit doses available are 5, 10, and 20. Therapeutic doses are 10 to 20. It's a very what they call a clean medication. It doesn't interact with a lot of other medications. Same with citalopram. Sertraline or Zoloft is also available as a generic. It's an older medication. The dosage is patterns are a little bit different. You have 50 and 100 milligrams. You can go down. Actually, they also have 25 milligrams, if I'm not incorrect. And you can actually go from 25 milligrams or 12.5 milligrams all the way up to 200 milligrams. Starting dose, some people say 25 milligrams, some people say 12.5 milligrams. And usual dose is anywhere from 50 to 100.
Is there any reason why you should combine, let's say, Prozac and Zoloft?
No.
So you don't combine them?
No.
What about, I've seen a lot of patients with not only depression but also anxiety. So are there any, I know, and I can't remember right now, but there was a med that was creating much more anxiety.
Sometimes people say that fluoxetine causes a little bit more anxiety. In general, all these medications have indications to treat anxiety. So they work for depression and anxiety because it's, this is not an anxiety talk, but they seem to be related. So generally when people say that it causes more anxiety, it's that restlessness, which is a little bit different. And generally the thing to do in that situation is go on to either try a lower dose or to switch to another one of these. In general, the best thing to do with things like anxiety, if people feel like that, is to just start on a much lower dose. And things like, actually, I like Prozac because it has a liquid form, and you can actually start at like 2 milligrams with people who are really anxious.